Pectoral, back and scapular region. Dr. Lubna Nazli. Objectives at the end of the lecture: students should know muscles of the pectoral region, clavipectoral fascia, muscles of the back, layer 1, layer 2, 4, muscles attached to scapula, 5, rotator cuff, 6, quadrangular space and triangular spaces, 7, nerves of scapular region, 8, arteries of scapular region, 9, anastomosis around the scapula, 10, applied anatomy, pectoral region, muscles of the pectoral region, pectoralis major, pectoralis minor, subclavius, and serratus. Anterior, pectoralis major. Origin: medial half of clavicle, sternum, costal cartilages upon neurosis of external oblique muscle. Insertion: lateral lip of intertubercular groove of humerus. Action: flexes, adducts, and rotates arm medially. Nerve: medial and lateral pectoral nerves of brachial plexus, pectoralis minor. Origin: ribs 3 to 5. Insertion: coracoid process of the scapula. Action: draws the scapula forward, medialward, and downward. Nerve: medial pectoral nerve of brachial plexus, subclavius. Origin: junction of the first rib with its costal cartilage. Insertion: inferior surface of clavicle. Action: pulls clavicle towards the sternum. Nerve to subclavius of brachial plexus. Serratus anterior. Origin: ribs 1 to 8 or 9. Insertion: medial border of the scapula on its costal, deep, surface. Action: it draws the scapula forward. Nerve: long thoracic nerve, from ventral rami C5 C7. IMP: a lesion of long thoracic nerve will cause winging of the scapula. Clavipectoral fascia. The deep fascia which extends between subclavius, coracoid process and pectoralis minor muscles. The structures passing through the clavipectoral fascia. Cephalic vein. Thoracoacromial artery. Lateral pectoral nerve. Lymphatics. Clavipectoral fascia. Muscles of the back are arranged in 2 layers. Layer 1, trapezius. Latissimus dorsi. Layer 2, levator scapulae. Rhomboid minor. Rhomboid major, trapezius. Origin: medial third superior nuchal line, ligamentum nuchae, spinous processes and supraspinous ligaments to T12. Insertion: upper fibers to lateral third of posterior border of clavicle, lower to medial acromion and superior lip of spine of scapula. Action: laterally rotates, elevates, and retracts scapula. Nerve: spinal accessory nerve, C1-5. Latissimus dorsi. Origin: spine T7, spinous processes and supraspinous ligaments of all lower thoracic, lumbar and sacral vertebrae, lumbar fascia, posterior third iliac crest, last 4 ribs and inferior angle of scapula. Insertion: floor of bicipital groove of humerus. Action: extends, adducts, and medially rotates arm. Nerve: thoracodorsal nerve, C6, 7, 8, from posterior cord. Levator scapulae. Origin: posterior tubercles of transverse processes of C1-4. Insertion: upper part of medial border of scapula. Action: raises medial border of scapula. Nerve: anterior primary rami of C3 and C4 and dorsal scapular nerve, C5. Rhomboid minor. Origin: lower ligamentum nuchae, spines of C7 and T1. Insertion: on posteromedial border of scapula at level of spine, below levator scapulae. Action: retracts scapula. Nerve: dorsal scapular nerve, C5, from root. Rhomboid major origin spines of T2 T5 and supraspinatus ligaments. Insertion lower half of posteromedial border of scapula, from angle to upper part of triangular area at base of scapular spine. Action retracts scapula. Nerve dorsal scapular nerve, C5, from root. Revise. Identify these muscles. Muscles attached to scapula. The muscles which join the scapula to the humerus are deltoid, supraspinatus, infraspinatus, teres minor, teres major, subscapularis, deltoid. Origin lateral third of clavicle, acromion, spine of scapula to deltoid tubercle, multipinnate muscle. Insertion middle of lateral surface of humerus, deltoid tuberosity. Action abducts arm, anterior fibers flex and medial rotate, posterior fibers extend and lateral rotate. Nerve axillary nerve, C5, 6, from posterior cord. Importance. Site of intramuscular injection. Supraspinatus. Origin medial 3/4 of supraspinous fossa of scapula. Insertion superior facet on greater tuberosity of humerus and capsule of shoulder joint. Action abducts arm and stabilizes shoulder joint. Nerve suprascapular nerve, C5, 6 from upper trunk, infraspinatus. Origin medial 3/4 of infraspinous fossa of scapula. Insertion middle facet of greater tuberosity of humerus and capsule of shoulder joint. Action laterally rotates arm and stabilizes shoulder joint. Nerve suprascapular nerve, C5, 6, from upper trunk. Teres minor. Origin middle third lateral border of scapula above teres major. Insertion inferior facet of greater tuberosity of humerus, below infraspinatus, and capsule of shoulder joint. Action laterally rotates arm and stabilizes shoulder joint. Nerve axillary nerve, C5, 6, from posterior cord, teres major. Origin oval area on lateral side of inferior angle of scapula below teres minor. Insertion medial lip of bicipital groove of humerus. Action medially rotates and adducts arm. Stabilizes shoulder joint. Nerve lower subscapular nerve, C5, 6, from posterior cord. Subscapularis origin medial 2/3 of subscapular fossa. Insertion lesser tuberosity of humerus. Action medially rotates arm and stabilizes shoulder joint. Nerve upper and lower subscapular nerves, C5, 6, from posterior cord, revise. Rotator cuff, musculotendinous cuff. The tendons of 4 muscles form the rotator cuff. The muscles are supraspinatus, infraspinatus, teres minor, subscapularis. Intermuscular spaces, quadrangular space, triangular spaces. Boundaries of quadrangular space. Above, teres minor and subscapularis. Below, teres major. Medially, long head of triceps. Laterally, surgical neck of humerus. Transmits, axillary nerve and posterior circumflex humeral vessels. Triangular space, upper, bounded by. Above, teres minor. Below, teres major. Laterally, long head of triceps. Transmits, circumflex scapular vessels. Triangular space, lower, bounded by. Above, teres major. Medially, Long head of triceps. Laterally, medial head of triceps. Transmits, radial nerve and profunda brachii artery. Nerves of scapular region. Upper subscapular nerve, supplies subcapularis. Lower subscapular nerve, supplies subscapularis and teres major. 3. Suprascapular nerve, supplies supraspinatus and infraspinatus. 4. Axillary nerve, supplies deltoid and teres minor, arteries of scapular region. The arteries seen are: transverse cervical artery, suprascapular artery, anastomosis around the scapula. The scapular anastomosis connects subclavian artery, and the axillary artery, forming an anastomosis around the scapula. It allows blood to flow past the joint regardless of the position of the arm.